Sleep apnea was something that was relatively new to me until a couple years ago. Still didn't really know what we could do as a dental office until Dr. Rudy and Mark sent me out to Idaho for a weekend class. And it is really a prevalent disease, causes a lot of systemic other issues, high blood pressure, stress, just basically wears the body out if you're not getting a good night's sleep. The most common indicator would be snoring, where snoring can be funny sometimes. And that's usually a good indicator something's going on. There's a lot of other characteristic traits that we can pick up on, whether someone had their premolars removed as a kid for braces, a large tongue, if we can't see the back of their throat. A lot of things that we can pick up on and indicate potential problems that could be life-threatening. What we can do is, if the sleep apnea is not too severe, is make an oral appliance that will advance the jaw forward slightly and maintain an open airway while they sleep. If it's a pretty severe case, then they're still going to be recommended for a CPAP. But we're seeing a lot of minor to moderate people that we can just help out feel better about themselves and get more rested. If someone suspects they have sleep apnea or just very severe loud snoring, they would come in for a free consult. We would look at medical history to see if there's any indicators for other systemic illnesses. They would come in for the consult. We would take x-rays if necessary. We would then send them to a sleep lab to have an overnight sleep study or a take-home sleep study. After we get the results back from that, that's really where we could get started. We can see how minor, how moderate, how severe their sleep apnea is. If they are a good candidate for a sleep appliance, they come back in, we take an impression, we take a few measurements, we send it to the lab, we get it back in 2 weeks, and we fit it. We go over how to wear it, and it is very, very unnoticeable. You can actually drink with it, you can talk with it. Some people get to sleep their first night and wear it all the way through. Some take a few days to a week to get adjusted to having something in their mouth, but it is a great fitting appliance, much smaller than a CPAP and less noisy.